In the past year, just since the beginning of the Affordable Care Act, enrolled 685,000 people in health coverage under the Affordable Care Act, and we're very proud of that in Illinois. It's far beyond what was predicted, and we're only 45 days from the beginning of the next enrollment period. That's going to be, I think, on November 15th, and we have our Get Covered Illinois folks here today. We want to make sure we get the word out to get more people in. Nobody left out. Very, very important. You know, we really support President Obama and the Affordable Care Act. We understand how important that is to families who work hard, who live from paycheck to paycheck. It's important that they have decent health coverage. And we don't want anybody with pre-existing conditions to be denied health coverage. We want everybody to be in, nobody to be left out. And just when I was coming in, I met a couple of our community health workers who are out in the neighborhood, going door to door, working with folks to make sure we identify issues that may be affecting their health. It might be something to do with asthma. It might be something that can lead to diabetes. It may be something that causes high blood pressure and can lead to stroke or heart disease. So we want to be on the front edge of making sure we keep everyone healthy in Illinois. And that's what the Affordable Care Act is all about. And that's what President Obama fought for so hard. He's from our state, and he knows firsthand how important it is to make sure that everyone has decent health care. That's a fundamental right in our country. And I walked across our state 13 years ago in 2001 from the Mississippi River, the Centennial Bridge in Rock Island, over the big river, Mississippi, all the way to Chicago and Lake Michigan on behalf of decent health care for everybody. And that's what the Affordable Care Act is about. That's why we've enrolled 685,000 people. We got more to do, lots more work to do, but today we wanted to kind of celebrate this anniversary of the beginning of the Affordable Care Act. Obviously, we learn as we go along. If mistakes are made along the way, we want to correct those mistakes so that in this enrollment period, which begins on November 15th, it'll go through Thanksgiving, it'll go through Christmas and New Year's and the holidays, it'll go even through the Super Bowl. It extends all the way to February 15th, and we want to have a Super Bowl of more people getting decent health care. That's what it's all about in our country. That's what we believe in. And I want to bring forward someone who's on the front line down in Springfield, because our state, we passed the laws to implement the Affordable Care Act. Our friends over in Indiana, they said no. Our friends up in Wisconsin, they said no. Those people down in Florida, their governor said no. The governor of Texas, no. That wasn't the right thing to do, in my opinion. We want to say yes to the Affordable Care Act. We want to say yes to people who work hard and deserve health coverage to cover their families. And that's what we've done in Illinois. We know that doing this Affordable Care Act and enrolling 685,000 people in a 1 year's period is a great achievement for everyday people. They oftentimes are counting on us to do the right thing and make sure that their families are covered. So we're very, very proud of what we've done in Illinois.
A little fact that not a lot of people know is that my mother started her medical practice on 18th and Loomis here in Pilsen. And at the age of 70, learned Spanish so that she could more and better serve her patients. So this place has a very special place in my heart. And imagine learning how healthcare should be delivered at the hem of a physician who graduated medical school in 1932, who understood, and if she was here today, would be very, very proud of Governor Quinn, very proud of Esther Corpus and Alivio for enrolling so many people, because we all know that most of the people, the new enrollees, were costing the state of Illinois a tremendous amount of money in a very efficient system by entering the healthcare system through our emergency rooms. Now, with the Affordable Care Act and Illinois expanding, they are actually finding health homes. They are actually coming in and visiting physicians and FQHCs and places like Alivio for preventative health care for themselves and their families. And that is all thanks to people like Esther and undoubtedly the man who is the governor of the state of Illinois. Thank you very much, Governor, for signing this. Unlike so many other governors, you are a real star.
Yes, Alivio is a population here that for most most times has been left out. So I just actually am very, very, very fortunate and happy to be part of this expansion that is occurring. That includes those who are not receiving those services. Thanks to Olivia, who understands and who's been a pioneer in reaching out to this community. I can't thank you enough for that, too. Esther, I know you've carried on Carmen Velasquez's legacy here, and it's hard shoes to fit in, but you're doing a fantastic job, and it's people like Esther that are making it happen.